I'm Jessica Thomas. I'm the Director of Patient Education for the NET Research Foundation. It is time for January's Thrivership Series, and we're going to talk about something that it's important to talk about, but sometimes we don't talk about it enough, and that is depression. Depression can play a very big role in someone's cancer journey. And today I just wanted to normalize a little bit of talking about it so that way we can understand why is depression a part of cancer, and then also why is it important to be proactive to try to stay a step ahead of depressive symptoms, and then also what are some tools and strategies that might be able to help you if you are dealing with depression. Now, this does not replace any conversations that you should have with your healthcare team. So I encourage you, if you are feeling any symptoms of depression or you've noticed changes in your quality of life, I want you to talk with your healthcare provider. So depression, it can be, pretty normal in a NET cancer journey. And there's a couple of reasons why, but just having cancer in itself can affect someone's mental health. And some of the contributing factors are the emotional impact. There's an emotional impact when you're facing a illness, either chronic or life-threatening, and making treatment decisions. And those things can trigger or exacerbate depression. Also, physical effects. Often, disease is not free of physical effects. So cancer, pain, changes to your body, things like that can contribute to depressive symptoms. And then the fear of reoccurrence, not knowing or dealing with the uncertainty about the future can lead to feelings of anxiety or depression. Social isolation, changes in our relationship and social dynamics can happen during cancer and cancer treatment. And this is a hard thing because it may lead to loneliness and feelings of isolation. And those are risk factors for depression. Financial strain, the stress of financial strain over treatments and costs and the aftermath can really contribute to stress and depression among people living with cancer. And adjustment to challenges, getting back to work, resuming your daily activities, and coping with your new normal can be very emotionally demanding and draining. So being proactive with depression is so important because it allows you the ability to have early identification. If we can identify the symptoms earlier, we can treat the depression earlier. And addressing those symptoms can lead to more effective treatment outcomes. And then we prevent things from getting worse. So if we're taking proactive steps to manage depression, then we're able to address issues promptly, and that can help them from being more severe or more chronic. And it improves your quality of life. When you are managing depression, it can help you with your overall quality of life, because if you're living with depression, as you may know, it actually can really impair your quality of life. And when we're proactive, it reduces the impact on our daily functioning. And depression can really impact our sleep, it can disrupt work, our relationships, our personal activities. So when we're managing depression, we are actually helping to maintain more regular daily routines and structures. And then it enhances our resilience. So developing coping strategies and resilience through proactive mental health care equips you to better navigate life's challenges. And it also helps as a buffer when things stressful, that could happen that might, exacerbate depression. And it's empowering. So when you proactively are addressing your depression, you are taking an active role in your mental health. And this allows an opportunity for self-awareness, self-efficacy, and providing just a sense of reducing stigma for mental health. Open discussions and having proactive steps to create a more supportive environment for yourself is going to also help to encourage other people. So not only does it help you, it helps others. And then it prevents reoccurrence. So sometimes we're proactive for depression just to prevent the idea of depression getting worse. So this is having long-term strategies to help manage your stress, maintain your well-being, and also to prevent relapses. And having positive impact on your health. So when we're proactive about managing depression, this can be helpful for your physical health because mind and body are connected. And also, it encourages support systems. So, by being proactive in addressing depression, this is going to foster open communication about mental health, but also it will encourage you to build and seek your support system. And what I have learned is that we can't do things alone and we shouldn't do them alone. We need support. So, there's a couple of varieties of things that you can do to help with your depression or help with depressive symptoms. One is therapy and counseling. Engage in therapy such as cognitive behavioral therapy or talk therapy can help you change negative thinking patterns. Medication can be very helpful in managing depression, but not only medication, but medication compliance, taking your medication as prescribed. And having regular exercise. Incorporating regular physical activity into your routine has been shown to have a very big positive effect on your mood and overall well-being. And a healthy lifestyle. This is a way to manage your mood by focusing on maintaining a balanced diet, ensuring proper nutrition, and this supports both physical and mental health. Adequate sleep is a proactive measure. Prioritizing your sleep hygiene aims for you to have consistent and good sleep each night, and that's going to help you be more emotionally resilient. Practicing mindfulness and meditation. When you practice these, this cultivates a more present focused and non-judgmental awareness of what is happening around you. Building a support system. By building a strong support system of either friends, family, or a support group, sharing your feelings and allowing yourself to provide and get emotional support is incredibly important. And setting realistic goals. Breaking down tasks that might feel big into smaller, more achievable steps is very helpful, especially if you are experiencing any feelings of sadness or overwhelm. And then limiting stressors. Identifying and managing stressors is important, and it can help you to set boundaries and have healthier relationships. And then engaging in hobbies or activities that you enjoy, or exploring hobbies and activities, can give you a sense of fulfillment and pleasure. Getting sunlight exposure, spend time outdoors. Natural sunlight can have a very positive effect on your mood. Journaling, giving yourself a space to reflect your thoughts, your feelings, your emotions. And this can actually help you to pull some insights and serve as an emotional outlet for yourself. And then seeking professional help, from a psychologist, a psychiatrist, a counselor, or a clinical social worker, even like me, who can offer guidance and support. There's also mind-body techniques, exploring techniques like yoga and Tai Chi, which can improve relaxation and also reduce stress.